Hey, guess what day it is? It's Aloha Friday Q&A with Dr. Pete. Welcome, I am Dr. Pete of Island Family Chiropractic. And every week we get on live and we talk about some of the things that concerning my patients, public questions that people have about anything and everything. I do have a couple jokes, but I'm saving that for next week. Next week will be about nutrition and exercise. But this week we're actually going to talk about men because we have talked about women's issues in the past, but of course women and children and men and certain ages all have different issues than each other, so they all have to be treated differently and with different methods and different ideology and different exams and all that other good stuff. So, first thing you need to know about men and treating men in healthcare. Number one is, who has the highest pain threshold? Mothers. So mothers at the hierarchy of pain threshold, then come women, then come athletes, then come my former NFL football players that I've treated, then comes boyfriends and husbands, then comes men in their 40s and 50s. So you're already dealing with a population that is not the biggest fan of pain tolerance. So they tend to be quite chickenish, but at the same time like to complain the most too and do nothing about it. So it takes a strong woman or spouse or partner to get a man to do something about their health. So that's why when I was many years ago, I lived in Lake Tahoe and I was part of the Rotary Club, that during the prostate cancer month, basically the advice was to have the women make the men go get the prostate checked and basically cut them off, if you know what I mean. Not cut them off, but cut the men off from a certain type of marital thing until they get their prostate checked. But anyway, so what are some of the difference in men's and women's conditions? Well, first of all, men tend to have less range of motion in their shoulders and in their hips and things like that. So what's going to happen is they'll tend to have more shoulder and rotator cuff problems, tend to have more low back problems than women do. And so that's going to not only affect their getting dressed and working, but also their sleeping on their side, being able to get up and tie their shoes in the morning and that kind of stuff. In addition, another problem that men tend to have is that they tend to wait longer, so they're more chronic when they come in. And that's going to take a little bit longer to treat. So one of the questions we've been asked in the past is, who takes longer to treat, men or women? Well, men take a little bit longer because they're starting from farther back of the start line because they waited longer for their conditions. It's more chronic. But at the same time, also, unfortunately, men don't follow through quite as well as women do. But of course, I'm speaking here about my experiences in Arizona, Nevada, and Hawaii, and what I'm seeing. Hawaii is a lot better for men coming in more frequently and following through better. That doesn't mean just because they're Hawaiian of descent, but that really does help too. But we also have military, and we have people like me who have moved from mainland and from all over the world. But there tends to be more of a focus here to follow through better on treatment. Another thing that we get asked is, what is the age range of men? Well, it's all different. We actually tend to see, we see kids. I saw 5 kids just yesterday, alone in the clinic, and of which 3 of those or 4 of those were boys. We tend to see teenage athletes, of course, the football and basketball players, sometimes the swimmers, the baseball players, and then we tend to start to see guys in college who are studying a bunch. We see the active duty military, we see the vets, and vets doesn't mean they're over 65. Vets just means that they did at least 4 years. And so we see 20s and 30s and 40s and 50s and 60s. We see everything. So that really doesn't change. But of course, the most important thing is, like, I started seeing a chiropractor when I was 19, but my back started hurting when I was 12. So obviously, with anything, the sooner we get in, the better. Another question we get asked quite a bit is as far as who comes in more often, males or females. Well, it used to be females quite a bit, as much as 70 to 30%. Compared to men, but that has changed over the years, and it's about 55-45 now, still more female skewed, but it's getting pretty close now. The other question is, how many of men, or what percentage, come in for massage? That's also gone up quite a bit over the years. That's almost up to almost 50% as well, just a little bit under 50%. So men are actually starting to take better care of them. It does help that the VA and certain other insurances cover massage. That does make it more accessible. And of course, having this day and age more accessible hours in evenings and weekends and Saturdays and Sundays also make it easier for people all kinds of jobs, men, women, working whatever hours to be able to get in and get those. So traditionally there was not that time when things were 9 to 5, Monday to Friday. Another good question is, who comes in more, white collar or blue collar? Or who has more problems as far as men, white collar or blue collar? You'd actually think it would be blue collar, right? So, the mechanics and the technicians and the tech guys and the garbage guys, construction guys, but that is not true at all. As a matter of fact, they just have completely different problems. The white collar problems are tech neck, are headaches, are low back pain from sitting at the computer, multiple monitors, and that kind of stuff. And we've talked about that before. In fact, it's an atrophy issue. We just joked the other day that common injury in active duty is actually, it's inactive duty. It's sitting in front of computer screens all day long. So the white collar will have those issues, and the blue collar will have more of, they're stiff, they're sore, they're tight. I had a construction worker yesterday that has trouble lifting his arm up, and we've got bricklayers, we have cement workers, we have mechanics, and again, it's just a lot of the feet, a lot of time walking back and forth and bending and doing the physical kind of stuff. But interestingly enough, they did do a study where they compared women to men's injuries on a job site, a construction site. And one thing they found is that it took a little bit longer to do things because the women asked for help. But on the other hand, they had fewer injuries and missed time of work, and work comp was lower because the women asked for help, as opposed to the men. So I think that's also getting better now, is that men are able to ask for help, and of course women being in much better positions now in all kinds of industries we didn't used to see them when our parents were kids, is that also making a big difference as well. So the equality is helping both men's health, and it's also helping lower men's injuries. So thank you, women. We do appreciate that. In fact, if all goes well, that men's life expectancy should go up as well, thanks to women being in the workforce. Sadly, women's life expectancy is going to go down instead. But hey, it's okay. We appreciate it. I'm not going to. I heard a joke in high school. Not going to talk about it. Okay. And then another question that we hear a lot of is, are there any sort of sports or exercises that cause men more injuries? Well, men tend to do weight training more and less cardio, so that's going to create imbalances in their pecs and their shoulders and their biceps. We had a patient yesterday that was concerned because their bicep was very sore. They might have aggravated, and they were doing some push-ups and some flies. It's just a strain, but he's been afraid to use it. And another guy who's a carpet layer and flooring guy, same kind of thing. He's now been afraid also to use it, even though we've got his shoulder back to where it needs to be. And that's another thing, is men tend to be more afraid to use stuff because they're afraid of injuring it, which then causes more atrophy and more weakness. So we want you active and back to doing your stuff as quickly as possible. Yeah, so flexibility, strength, massage, all the things that men need, and asking for help and lifting and carrying things, all those things men need, because they tend to overdo it in a different way, lose their mobility more than women, and thus end up with those types of pec, shoulder, neck, and low back injuries. Anyway, that's enough about that today. There's so much more we could talk about when it comes to the different conditions we treat and the stuff that comes in. So if you have specific questions, drop them in the chat. Reach out to us at Island Family Chiropractic, www.islandfamilychiro.com, ifcoahu@gmail.com, on Instagram, and we will have a big announcement next week. It is something to do with maybe a bigger clinic, maybe a bigger location, maybe more services offered. It could be a lot of things, but either way, I'm Dr. Pete, and it's been Aloha Friday. Mahalo, and have a great, blessed weekend.